Hello, my name is Deepika Reddy. I'm a clinical research fellow at Imperial Prostate here in the UK. And thank you for your time in listening to the oncological and safety outcomes of 356 patients undergoing focal ablative salvage therapy following radiation failure for prostate cancer. A considerable proportion of patients report a recurrence following radiation treatment within 5 years. Recurrence tends to relate to the index lesion. Our aim was to evaluate the failure-free survival, the overall survival, and adverse events associated with focal ablative salvage treatment following radiation failure. We analysed consecutive patients reported in focal therapy registries called HEAT and ICE within multiple UK centres. For patients that had brachytherapy failure, anterior or seminal vesicle disease, they underwent cryotherapy, and HIFU was predominantly used for those with posterior disease. This resulted in 356 patients eligible for an analysis, and with a relative 50-50 proportion between HIFU and cryotherapy. A considerable proportion of patients underwent quadrant ablation, with a few undergoing hemiablation and even fewer undergoing hockey stick ablation. The median age of our cohort was 69 years, median PSA of 4, and the median follow-up time was 41.3 months. This led to a failure-free survival of 75% after 6 years, in which failure was defined as the transition to salvage whole gland treatment, to the transition to systemic treatment, or the development of prostate cancer metastases. The median time to failure was 15.5 months, and only 8.7% of patients underwent a repeated focal therapy session. When looking at overall survival, our 6-year survival rate was 88%, in which prostate cancer specific mortality was 2.8%. And when looking at our safety outcomes, we saw only 1 patient reported to have a fistula. 16 patients were treated as outpatients for post-procedural urinary tract infections, and 1 patient requiring a TURP and artificial urinary sphincter. And these safety outcomes are very much comparable to those already published. So, to conclude, we can see that focal ablative salvage therapy after radiation failure for specific patients is safe. It can provide good short to medium term oncological control whilst delaying the transition to systemic therapy, its associated side effects, and transition to second-line systemic therapy. Formal functional outcomes are required and being assessed in the forecast study, the results of which are due soon. And we believe a randomized controlled trial in this area is justified. Many thanks.